Okay, in this video, we're going to talk about estimating pretest probability. In the previous one, we talked about probability and kind of how we use it. So this also, again, falls here in prioritizing a differential diagnosis or testing a differential diagnosis. And in previous videos, we talked about problem representations, and it's kind of like an illness script for a patient, right? We looked about the epidemiology, time course, signs and symptoms, diagnostics, and other past medical history that a particular patient may have. And now we want to compare that to an illness script for a disease. We want to compare the patient that we have in front of us to a disease that we're considering, and we're going to compare very similar things in the illness script here. And from that, we're going to determine what probability we think that disease is in this particular patient. Okay, and so we previously talked about dividing up the probability space into different zones here, and I took these zones from Catherine Lucy. She has some videos on YouTube that I stole this from. Those are great videos. I think you should watch them if you get the chance. And the reason is because it is not that mathematically precise to say someone has like a 7% chance. We don't have enough information to make that accurate, that precise an estimate. So we're going to say, we're going to put them in these zones, like very unlikely, unlikely, uncertain, likely, and very likely. And the greater the match between a patient's disease, the patient, and the illness script, the higher the probability is. And the lesser the match between a patient and the disease that we're considering, the disease illness script, the lesser the match is. And so how do we determine that? So we said that if there are key features, so those are pathognomic features, those are things that define a disease. If someone has features that define a disease, we would say, yeah, that means that disease is very likely. If they have rejecting features that when they are present, you say a patient doesn't have this disease, then it's pretty unlikely that they have that disease. And then if they have some differentiating features, we may call it likely. If they have very few differentiating features, we might call it unlikely. And anything in the middle, we would say is uncertain. Okay, so I'm going to go through a couple examples here. And here is a key that we're going to use. So a key feature we'll designate by a star. Okay, so a rejecting feature here are features that are very unusual in the disease in question. So if a patient has this, the diagnosis is pretty unlikely because that disease very unlikely has that. Missing some differentiating features, this makes a disease less likely. Having some differentiating features makes the diagnosis more likely. And having key features that are those pathognomic features, it makes a disease very likely. Okay, so let's take a look. So remember here, we are going to try to compare the illness script for a disease to the problem representation that a patient has. And so that's the patient illness script. These are the components we're going to look at. Epidemiology, who commonly gets the disease, and we'll compare that to who is our patient. The time course, how does the disease start and stop, and what happens in between. And we're going to look at it for our patient. When did it start, when did it stop, and what's happening in between. Signs and symptoms, what are some things you would find on history and physical in a patient with this disease, and we'll look at our patient and say, what did we find in our patient? Did they have any signs and symptoms that match? And if we have the results of testing, we can compare testing too. Many times you won't have testing, sometimes you do. So let's look at our headache example, okay? And we have a 42-year-old smoker, and this is going to be our problem representation. A 42-year-old smoker with a headache that started 9 hours ago. It's constant. It's been getting worse. He describes it as a very bad headache. His neck is not stiff. He didn't pass out. Lights do bother his eyes. His neurologic exam is normal. His temples are not tender. We haven't ordered any tests yet. And so one thing that was on our differential was temporal arteritis. This is an inflammation of some of the blood vessels. It's also called giant cell arteritis in the temples. And so you can see here, it usually happens more in females than males. It's worse in smokers, and it's very rare if you're younger than 50. It takes days to weeks to occur. Here are some symptoms you might see and the percentage of the time that you might see it, okay? And then some blood tests that you might see. So we know that This person is 42. It's very, very rare if it's someone's under 50. So, that might be a rejecting feature that we have here. Patient is a smoker. Smoker matches. It is a bad headache, and they have a headache there. And it started pretty recently, right? It started today, 9 hours ago, and been getting worse. Whereas this one takes days to weeks to occur. So we have one rejecting feature, we have a few differentiating features, and we're missing one differentiating feature. So maybe we put that one pretty low, temporal arteritis, in our patient because it's got rejecting features. Okay, let's look at the next one. Now we're going to look at, it's the same patient's problem representation, but now we're going to look at subarachnoid hemorrhage, and this is the illness script that goes with that. And we see how common it is. It's about 6 to 16 in 100,000 patients. Peaks at age 50, more in smokers, rare if younger than 10. There could be sentinel leaks, so that means a bleed that starts initially, that's like a warning sign, and then you get the big aneurysm that bleeds. A subarachnoid hemorrhage is, I should tell you, it's a bleeding aneurysm in the brain, and it causes a headache, and it could actually be lethal. And that bleed usually lasts for hours to a few days. Okay, and this is how it's typically described. Worst headache in my life. They may have vomiting, neck stiffness and pain, photophobia, meaning the lights do bother them. They might lose consciousness. Okay, and here are some blood tests you might see. So let's take a look now. Smoker, yeah, we have that, right? It's more often in smokers, right? Peaks at age 50. You could even say, okay, he's the right age for it. Started 9 hours ago. The timing is right. Yeah. We are missing the differentiating feature of neck stiffness, right over here. Lights do bother the eyes, and so we have that over here, photophobia. So we do have some differentiating features. We're missing a few differentiating features. No key features, no rejecting features. So maybe we put that up here. Let's say somewhere in the uncertain category. Let's make up a number, 45%. Okay, let's look at one more. Okay, and so now we have meningitis. Meningitis is a disease that is the infection of the layer surrounding the brain, the meninges. Okay, and we can see that it's highest in less than 1 year old, but it could happen in really any age. But these are the people that it's highest in. It starts over the course of hours to days, and here are the symptoms you might have: fever, vomiting, headache, neck stiffness and pain, lights bother the eyes. Usually a normal neurologic exam, and they often will have a rash with it. We call it a petechial rash. And if you do, here's some blood tests, you might do a lumbar puncture or a spinal tap, and it'll show you some stuff there. So in our patient, time course matches. We are missing that the neck was not stiff, but the lights do bother that person's eyes. But let's say, then we also decide to look more at the patient, and the patient does have a rash, right? This petechial rash, and that's one of the key features for this. And not only do we have that, while you're doing that, the patient spikes a fever to 102 degrees. And so we got fever now and rash as well, the petechial rash. And so maybe that bumps you up here to like 90 degrees. And you think, I think this is very likely. 90%, sorry. And so now you could see how we had over here we had a couple of key features, and we had some differentiating features, and we're only missing one differentiating feature, right there. And so maybe meningitis we would put over here. And so that's how we would kind of estimate our pretest probability, by matching an illness script to the problem representation for our patient. And so we're going to break that probability space into a couple different zones. And this is just an estimate, right? You don't have to say 42%. You could say, it's in my uncertain zone. I think it's somewhere between 30 and 60, 70%. And if they have rejecting features, we would say, okay, it's unlikely. If they have key features, we might say that it's more likely. And so that's how you estimate pretest probability. That is, the probability that someone has a disease before you've gotten any testing. Okay, thank you guys for watching.